to provide for that. Bathrooms are out this door to the left, immediately outside the door. If you would, please put your phones on silent. And we will be eating lunch about noon. And we have a new team that's helping serve our account now within COVA. And if you would at lunch, please stay for, even if you need to leave, please stay for a few minutes and meet our new adjusters and people within COVA that are serving our account. Just wanted to start out, the program currently covers about 100 agencies, boards, and commissions throughout the state. Each agency has a primary contact that's used in our policy correspondence. It's extremely important that if you have a contact for your agency and that contact changes, please let us know. We use those contacts for claims, to contact the agency to get information, but we also use it for billing. And it is a nightmare for me sometimes when we're doing our billing to try to gather the premium to pay in COVA, where I'm reaching out to agencies and I'm getting undeliverables back from the agency. And especially the small agencies, it's very hard for us to try to get a hold of somebody that can get us the information we need. And what it ends up doing, it makes everybody end up late getting our premiums paid. So make sure you please let us know that. And the other thing it's important to let us know if you have any location changes. I'll give you an example. I had an agency that invited me out, and for a visit, I showed up to the agency, and the building I went to actually was no longer that agency anymore. They had closed the building and moved, but they didn't let us know. I was actually with Brent, and they didn't know either, and they insured the building. So those things happen, and we just ask you to please let us know when changes like that occur. Because if you don't let us know, we're not going to know. Just wanted to cover a little bit. The commissioner touched on this some, but I wanted to just show you a little bit about how the program is trending as far as frequency. As you can tell, looks really good. We're bringing the numbers down. We were roughly at a little over 1,518, 1,454 and 19, 1,459, and you can see just each year we're gradually bringing it down. So this is something I'm very proud of, and we're doing a really good job with this. After 3 years of steady downward trending, the fiscal year 2023 frequency decreased by 155 claims, or almost 12%. That's outstanding. Injured workers have 6 months to file a claim for traumatic claims and 3 years from the date of last exposure or diagnosis date for occupational diseases. So we could see some of these numbers change a little bit depending on that if additional claims are filed. But it does look good so far. The fiscal year 2023 frequency decreased by 375 claims, or almost 25% compared to 2018. Here's where it doesn't look so good. We are reducing our claims, but our costs are going up. And there's a lot behind the scenes causing that to happen. A lot of this is the fact that we have an older workforce. We have a lot of comorbidities and things with our claim. And I'll give you an example of what I'm going with. We could have two people with the same injury. One person, that injury is going to be very cheap or inexpensive to take care of that claim. The other person may have a bunch of other comorbidities that causes that, let's say it's a cut, to get infected or not want to heal, and those claims end up costing a lot more to take care of. We're seeing that. We're seeing that we don't get hurt as often, but when we do get hurt, it's costing us a lot more than what we would like it to. One of the things that can impact this as well is if we do not utilize tools that we have at our disposal to reduce those costs, such as return to work, getting people back to work as soon as we can. It's also impacted by the fact that we have some employees that just don't want to be there. They would rather be off work and get, as any of you that's been around for a while, we had a speaker here years ago that talked about mailbox money. They would much rather go out to their mailbox and get a check than have to show up to work to get that check. So we have all these things working against us, but we've got a lot of work to do to bring down the severity, but we have a lot of plans working with COVID to try to do that. I was thinking about this because this is really a bummer to me to see this, because my job is to get these claims down, but I keep seeing the costs going up. One bright spot is this. Can you imagine what that severity would be if we had 155 more claims? It would have. So we're still making progress, but we still have a lot of work to do. In fiscal year 2023, our incurred costs increased by more than $250,000, or a little over 2%. Even when considering the significant 2023 frequency decrease, the average claim cost is at its highest level at $10,400, almost $10,500 per claim. The average claim cost is even higher when incidents or claims that have no payments are removed out of there, which brings that up to $13,200. The severity increase can be attributed to a fatal accident that we had last year that has a cost of about $3.4 million. Excluding the fatality and the incidents, the average claim cost per claim is at $9,400, a little over $9,400, which is still high. Looking at, it's really unremarkable as far as the different types of claims. We are seeing our incidents, which is no cost claims. Those are coming down, well, that's good. Indemnity costs are coming down, not the cost, but the number of claims. And our med-only claims are up a little bit, but those aren't the big cost drivers. The incidents are claims with no payments, and we have no reserves. Incident reports account for about 20% of the total claims submitted. Indemnity claims are the most severe. Indemnity payments are wage replacement benefits when basically the employee can no longer come to work, so we're ended up paying them to stay at home to heal. Indemnity claims account for about 26% of our overall cost, with 95% of our overall cost, 25% of our total claim costs. Medical only claims require medical treatment, but the injured worker was able to continue working. I did want to mention a little bit, we were talking about fatalities. We have had 10 fatalities that have been filed within COVID since we joined with them in July of 2017. The total cost of the 10 fatal claims is a little over $8 million. Above all, these aren't just numbers, these are our coworkers that basically came to work one day and never went home. And it's something we never want to have happen, but we have had it happen. And it's a tragedy every time it does happen, but we need to continue to do everything we can to try to prevent those. Multiple claimants. This is one of the big issues we have in this program. And these are employees that we have that just file claim after claim after claim. And this is one of the reasons I asked the Department of Personnel to come here today, is to help us walk through and navigate when we have employees like this. How do we work with them? What are the tools at our disposal? We currently have 539 claimants with 3 or more claims since July of 2017. That may not seem like a lot, but I know a lot of people that have worked for the state 25 years that have never had a claim. These aren't particularly people that are working in high-risk jobs. They just file claim after claim after claim. And a lot of times, these are employees that also has a disciplinary track record at that agency. And when you have an employee that is constantly filing claims like that, it also is a real productivity problem for that agency because you're constantly trying to cover their shifts and different things like that. So it's something we really want to try to get our hands around. We've had 93 claimants with 5 or more claims since 2017. The total calls for the 93 claims is a little over $2.1 million, almost 2.2. One claimant has 10 claims totaling $17,000. 4 claimants have 9 claims totaling $137,000. And I'm not going to cover all of these, but you can just see it just keeps adding up. But when you start having people having multiple claims like that, they're not huge claims, you start seeing big dollars add up. So it's something we want to really try to take care of at our different agencies, and I'm hoping the presentation from DOT today will be something that will help us navigate that challenging issue. Large losses, I'm going to look at the screen, I can't really see this. Under large losses, we currently have 14 claims that exceed our $250,000 deductible since 2017. The total incurred for the 14 claims is $14 million. So our average incurred is about $1 million each time we have one of those. 12 of the claims exceed $500,000 and 5 exceed $1 million. The most severe program, which I've already spoken about earlier, which was the motor vehicle accident fatality we had last year. We have a lot of motor vehicle accidents. We've had 326 since we've been within COGA. The total incurred for our motor vehicle accidents is $7.6 million. As the commissioners stated earlier, I've partnered with Brim, and when we go out and do our normal visits, we incorporate motor vehicle accident reduction into all of our visits to see what the agencies can do. And it may be something as simple as improving the maintenance, the brakes, things like that on the vehicles to make sure they're in tip-top shape or we're not having those accidents. Or also could go that we're doing record checks to make sure we don't have people that have 15 speeding tickets driving state vehicles. And you wouldn't believe some of the things we find out when we do these visits. Agency EMOD, just a general statement. An EMOD of 1, and it's much more complicated than this, but just for a general understanding, if your EMOD is 1, your losses are roughly where you would expect them to be for an agency when compared to peer organizations that do similar things to what you do. So I just wanted to explain that to give you some perspective on what I'm covering here. The highest EMOD in the program right now is 2.48. So they're paying almost 2.5 times more premium than what they should be based upon their loss history. And that's big dollars. The high EMOD increased the agency premium by almost $150,000. The agencies with the lowest EMOD, the Governor's Office and the Department of Environmental Protection, these agencies combined to save over $211,000. There are 33 agencies with an EMOD below 1, 52 with an EMOD of 1, and 15 agencies with an EMOD above 1. And we're slowly seeing over time the at 1 or below 1 are going up, so agencies are improving over time. How to control your premium cost. Focus on the safety of your employees, and when I'm talking about focusing on that, when you have safety committee meetings, make sure you're looking at employee injuries and incorporating those discussions in safety committee. A lot of times I'll look at safety committee minutes from an agency. They're talking about everything else except for employee injuries. They're talking about doing fire alarm inspections and fire drills and all the stuff we still have to do. but they're not talking about the things that are actually happening as far as injuries at that agency. So have part of that safety committee, have an area where you're actually looking at your losses, investigating those losses, and documenting what can I do to prevent those from happening in the future. You can lower your EMOD with an effective return to work program. I highly encourage all agencies to implement that in your agency. And COVA has great resources to help with that. If you ever have any need for help with that, let them know, and they would be happy to help, send somebody out to help you. Make sure you do appropriate training using personal protective equipment such as gloves, eye protection, etc. And using the preferred provider directory through COVA to make sure we're getting the best value for when we're getting medical care. Ensure agency classifications are correct in your payrolls program. We're basing your premium off of what you tell us your payroll is and things like that. If that's not accurate, if you're not enough, or if it's too much, it's going to impact your premium. So you need to make sure everything's accurate when you report it to COVA or us, SAWC. Verify all your claims have the correct site code. We send out to the different agencies a list of claims. Every 3 months we send it out and say, here's what we're showing you have. If you have something that shows up on that loss run that does not look like your claim, if it says nurse fell and you don't have nurses at agriculture, let's say, then let us know it's been coded improperly. Use first aid when possible. We see a lot of people that end up going to the emergency rooms or urgent care that basically could have washed the wound up, put a Band-Aid on it, and it ends up costing us $2,000 because they went to the emergency room. And use primary care versus emergency care. So if there's any way you can just go to a regular doctor's office and avoid going to the hospital, and it's going to be so much cheaper for you in the long run. So you need to keep in mind when we're talking about medical care, we are self-funding and paying for all this medical care out of the fund we set aside for each agency. So you're basically cutting a check every time that somebody goes. So, other way of controlling premium costs, and I just wanted to mention this because I think it's really important. I used to work for a CEO in a hospital years ago, and she would always talk to us about being in the moment. I never really understood what she was talking about, but after I was there a little while, what she was talking about is whenever you're meeting with your employee, that employee may only have one meeting with you a year. And her point was not to be on your cell phone and looking at emails and things like that when you're meeting. Giving them your full attention. One way to control premium costs is we've got to get our employees to be in the moment. We have employees that are just numb to the hazards that are in their environment, and I'm gonna pick on, let's say highways. We've got workers out there that are in construction zones that are in very dangerous situations, and they need to be in the moment to know that next car coming could be somebody that's on drugs or alcohol, or a teenager on their cell phone, or an old man like me on their cell phone, not paying attention to what they're doing. Or it could be the DHHR nurse entering that room with that patient, being in the moment to make sure they're protecting themselves if they act out. That's a huge way to try to control our premium costs and reduce our injuries. I've already talked about this, but focus on your safety program as far as looking at injuries in your agency. Partner with the SAWC program manager and COVA, our loss consultant. Paying your premiums timely, that's part of the agreement we have to get a 25% discount, is that we're going to pay our premiums, or we're going to do it timely. Report your claims timely. We always want to get claims reported timely, because the quicker you can get those in, the quicker COVA can get those people that need care, the care they need, get them on the medications they need, and that wound that would usually with antibiotics not become infected, if it's reported late, can very well get infected and end up costing you more over time. And reporting serious injuries to myself or to Chuck or anyone at ANCOVA, so we can go out and do an accident investigation if needed. And typically we're going to come out together to do that. But we would like to, any serious injury like that, we would like to come out and partner with you to see what we can do to prevent that from happening again. Also, one of the things I've noticed, and it seems like it's getting a little worse, is reporting details of a claim. I just had a claim reported this last week, I believe it was. All it said in the narrative was happened in training. What happened? I saw one not long ago, it struck. I saw one that just said fall. That's nice, I can kind of get the fall. I know you had a fall, but what'd you fall on? What happened? We need those details. Because what happens is, you're putting a lot of extra work on that adjuster now because they're gonna have to go find out who my contact is, call the agency, find out all the details. And we're never gonna be able to document it at that level quite like you did right then and there when it happened, because it's hard to investigate an accident after everything's already over with. And you're just going by what people tell you, as opposed to somebody that was right there and saw everything. All right. Pretty much covered everything I wanted to cover, I believe. Does anybody have any questions about anything? Yes?
If we are not receiving that quarterly report that you spoke of, who should we contact?
Those go to the cabinet secretaries at all the different agencies, and then they let that information out to whatever people, different managers, directors, or whatever they choose in that agency. It's up to that level to determine who gets that information. But we do send that out so they know what's happening in their organization. Most of the organizations I work with, they do have like an internal structure, and that goes out to certain people. But I send it to them, and that, where it goes from there is up to them. Yes? We have a list of e-mods.
So can we access it, or do we have to call y'all?
Just email me,
Okay.
and I can get it to you. It also is on your invoice. Every time we send out your premium every year, it has your e-mod right on that piece of paper. Because basically what you're doing is they're gonna show how they manually calculated your premium. And then if your e-mod's like the one agency up here a minute ago that was 2.5, and your premium was 100,000, that premium is gonna become multiplied by e-mod 250,000. So it's right on there, clear as bell. But you can also contact me, and I'll be happy to send it to you. You're welcome.
I have a question.
Hold on, let me see if this, testing, let's see if we can, testing, not working.
The local hospital that the majority of my employees go to, we always hand them an Encova packet to take with it. They won't fill it out, they say that that's not the proper documentation, so can we go ahead and submit like the incident report that our shift commander or the employee completes about the injury and go ahead and start the process? Because it takes a very long time to get that hospital.
You wanna let Encova know about anything, regardless of what problems you're
Okay.
having with that hospital. Let Encova know, and they can get on it,
Okay.
if they have to.
Okay.
It'd be preferable for you to be able to get all that and everything goes through just perfectly,
Right.
but we want Encova knowing about it as soon as possible, because they can help you navigate that.
Because we had an employee get hurt and I drove him in one of our vehicles to that hospital. And he come out and he was like, they won't fill this out. And I was like, I have to have this, like, I am the person that does this, I have to have this stuff. And they were not happy about it. And then about 2 weeks later, we had another guy go down there and he said that they absolutely refused to complete it.
And that's not unheard of. We have
Okay.
clinics all over the state
Okay.
that are like that. It's like we've talked about employees, we have challenging employees, we have
Right.
challenging hospitals and healthcare facilities to deal with.
Okay.
They don't wanna do it because they're not getting paid to do it.
That's what I was thinking.
Well, you know what I mean, they're getting
Right.
paid through, for
Right.
the comp, but they're not getting paid for all that paperwork.
Okay.
I wanted to mention one other thing while I'm up here. We were talking about severity. I wanted to explain to you that when we're talking about severity, we are talking about the costs that we currently have. Then we also set reserves. So if we have a severe claim, like a fatality, we're gonna pay for all the costs we have right now. But, and one of the reasons that we have fatalities can be so expensive is when we have one of our employees pass away due to a workplace injury, we also take care of that family, that wife, or the husband, or the children, or whatever. And those costs can be very significant. So our upfront costs, we may have $100,000 in that fatality right now, but we also might have $3 million in reserves for future costs to put that child through college or all the different things that we have to do to honor that employee and be a responsible employer. So these costs are all, we've paid it right now, there are future costs on some of these severity claims, but does that make sense? Okay. Any other questions?
Where can we access the most current preferred provider directory?
I'll have to defer to Encova for that.
I'm gonna go over that in my presentation, but on our website, there's a place that you can go and indicate that you're, filing a claim or you need claim information, and then you fill out the preferred provider network. But I will be going over that, and it'll have the information in the presentation, so you have.
Thank you, Rose. Any other questions? All right. The next speaker we have is going to be managing employees with multiple injuries and incidents. Carrie Nice, she's with the West Virginia Department of Personnel, she's the Assistant Director.